Hi, I'm Meghan Aldrich. I'm one of the pediatric nurse practitioners at Westwood-Mansfield Pediatrics. Today we're going to talk about constipation, which is one of the most common causes of abdominal pain in kids. This video is intended for patients of Westwood-Mansfield Pediatrics only. If your child goes to another practice, then you should contact his or her pediatrician, as they may have differing views on the subject. Constipation refers to stools that are often difficult or painful to pass, or less frequent than usual. And pain from constipation is usually caused from gas, and also the digestive process itself involves waves through the intestine. And when there's a blockage, then you can have some nausea, some cramping, and some pain from that. Constipation is not dangerous, but it can become a chronic issue with children over years or even into adulthood. So a child may be constipated even if they're stooling once a day or having soft stools. And you can equate constipation to an iceberg. So basically a kid has a big iceberg in his belly, and then he goes to the bathroom, and maybe when he goes, he just passes a little piece off of that iceberg, but the remaining part is still in there. And we see this a lot in pediatrics because kids don't want to go to the bathroom, they want to play, and if they go to the bathroom, they just want to hurry up and go as fast as possible and then get back to playing, which usually results in them not going all the way. And so kids can get backed up even if they are going daily. Infants, really young infants, especially breastfed infants, can go up to 7 days without stooling, and a lot of parents get concerned that their child may be constipated when in fact this is just normal. As long as they're happy and they're not distressed or crying when they are passing stool, then it's okay to just monitor them. Unless they're starting to pass small pellets, then that could be a sign of constipation. But again, breastfed babies especially can go a week without stooling, and it can be considered normal as long as they're happy. And a lot of this has to do with just the way they're absorbing the breast milk. It's just they're a little bit better at doing it. Another misconception is that babies less than 6 months of age look like they're struggling when they're going to the bathroom, and a lot of this has to do with the fact that they're just lying down. So sometimes they'll be grunting, or their face will get flushed, and parents get concerned that these are signs of constipation. But if they're happy and they're not crying when they're passing stool, then a lot of time it just has to do with the fact that they're lying down, and if you just flex their knees into their chest, that will help facilitate the passage of stool, because that's the squatting position, which is the most natural way to pass stool. There are a couple of different factors that go into constipation, and one of the biggest ones is dietary issues. So constipation is often due to a diet that lacks fiber, lacks hydration, so kids aren't drinking enough fluids, or also eating too many dairy products like milk, ice cream, cheese, things like that, which are highly constipating foods. Other reasons for constipation are behavioral, in that some kids just don't go to the bathroom regularly, and if we don't have regular sit times or toilet times, then we can get backed up. And this is very common in kids because they don't like to go to the bathroom at school, so a lot of times this results in constipation. Also, not getting enough exercise can lead to constipation as well. Constipation during toilet training is a very common issue that we see in pediatrics. If a child has pain with defecation, then they will often hold the stool in the future to avoid that pain. And this results in them doing sometimes what's called the duty dance, where they may cross their legs or wriggle around or go back and forth on their toes. And what happens is, when a few minutes after their body gets the signal that they're not ready to pass stool, and the stool can actually go into the reverse direction, away from the anal sphincter. So the stool will then collect in this area called the rectal bulb, which is just before the anus, and enlarge in size. And it often gets so enlarged that the nerve fibers in this rectal bulb stop working, and then the child doesn't know when he or she needs to go to the bathroom. The stool can remain really hard in this area, and then you can get leakage of softer stool around it, which leads to accidents. And this makes it nearly impossible to toilet train. So a lot of times if we have this scenario, we'll tell parents to just stop toilet training and focus on treating the constipation. until that's resolved, and then they can go back. This is also a common phenomenon in school-age children. Oftentimes it's around stressful periods, or it can happen as a result of not going to the bathroom at school. So kids will hold their stool, and then a toilet-trained child may end up having accidents because of this reason, because of the buildup of hard stool in that rectal vault. So these are the common causes of constipation. The treatment of constipation involves dietary, behavioral, and sometimes medical interventions. And it's really important to emphasize that the treatment of constipation can be a long-term thing. There's no quick fix with constipation, so you really have to put in the time and the effort to treat. The most important thing to start with is dietary treatments. So in infants, a lot of times you can use prune or pear juice twice a day, and that will help relieve constipation. Infants that are eating solids, you can do strain foods such as peaches, pears, prunes, and plums, the pea fruits, and that will also help with constipation. For older kids, making sure they're eating plenty of fruits and vegetables, at least 3 servings a day. If we can get them up to 5, that's great. But fruits and vegetables have lots of high fiber content in them. Things like prunes, figs, dates, raisins, apples, and the pea fruits, peaches, pears, prunes, plums, broccoli, other green leafy vegetables are high in fiber content and will help kids stay regular. Also increasing bran, which is a natural stool softener because of its high fiber content, can be helpful. Sources of that include whole grain cereals, graham crackers, bran muffins, oatmeal, whole wheat bread, things like that. Popcorn's another really good high fiber snack for kids that are older than 4 thinking about choking hazards with that, but it's another high fiber food to help. Decreasing the amount of constipating foods is also important in the treatment of constipation. So limiting dairy products to 3 servings or less a day. So limiting things like ice cream, cheese, yogurt, and cow's milk. And of course, increasing fluids in your child's diet is very important in helping treat constipation. An easy way for a kid to know if they're drinking enough is to tell them to make sure they're avoiding clear. And that's just an easy little rule for them to follow. Behavior treatments, really important is to encourage kids to have regular sit times on the toilet. If they don't have regular habits, then they're going to end up getting backed up and not go enough. So an easy way to do this is have them sit on the toilet for 10 minutes after breakfast or after dinner or both. A lot of kids don't want to do this, so sometimes encouraging them to sit with a video game or a book can be helpful just so that they sit for those full 10 minutes and then hopefully be able to pass stool. Sometimes diet and behavioral modifications aren't enough to treat constipation, so we do need to do some medical interventions. And this is when we would recommend something like a stool softener like Miralax. Stool softeners are great because they're not habit forming. They work to soften the stool by drawing water into the stool, just like fiber, which makes them nice and soft to pass. They also avoid the discomfort of using enemas. We try to avoid enemas as much as possible in pediatrics because they're not pleasant for kids. So Miralax is wonderful. It's a powder that you can buy over the counter, and it dissolves in 8 ounces of liquid. And you want to talk to your pediatrician or nurse practitioner about how much Miralax you should be using for your individual child because it can differ. So again, contact your pediatrician if you do want to use Miralax. Some pediatricians and nurse practitioners also would recommend the use of X-Lax, which can also be bought over the counter and comes in a chocolate chewable form. It's important to know that if you do use Miralax or X-Lax, it can take several days to alleviate the acute symptoms of the constipation, and then may take weeks to months to be on a maintenance dose to help in kind of resolving the issue. Again, emphasizing that constipation, there is no quick fix. It's really a long-term treatment. Some red flags to look for with constipation include if your child's double over in pain or not able to walk because of their stomach pain, if they're vomiting, if you notice blood in their stool, pain waking them at night, or if the pain is in the right lower quadrant, or if they're refusing to eat. Just an important note about blood in the stool, a lot of times kids that are constipated can have blood on the toilet paper or outside of the stool because of what's called an anal fissure. So basically they can get a small tear around the anal opening if they do pass a hard stool. And a lot of times Vaseline and sitz baths can be good for treating that, as well as treating the constipation itself. So that's a quick summary of constipation. I hope that you found this video to be helpful. Obviously, if you have any questions, feel free to call our office, speak to one of our nurses, or set up an appointment with one of the pediatricians or nurse practitioners.